What is the difference between a benign and a malignant tumor?
Benign tumors grow and push surrounding tissue and organs out of the way. Although pressure from a benign tumor can damage surrounding tissue and organs, it never invades these structures. Some benign tumors can grow quite large without causing any problems. These tumors do not spread to other parts of the body. They are surgically removed where necessary and possible. Malignant tumors invade and destroy normal tissue from the time they grow. They have the ability to spread to other parts of the body. The word cancer only applies to malignant tumors.
How does the doctor decide what treatment is right for me?
A number of factors will be taken into account before your doctor recommends the best treatment for you. 1. What type of cancer do you have? 2. How big the tumor is. 3. How fast it's growing. 4. Whether it has spread to other parts of your body, and if so, where to and how far it has penetrated. And 5. Your age, symptoms, and general health. Cancer treatment has improved dramatically over the past 50 years, as different therapies are used together to improve the chances of survival.
What are the usual treatments?
The 3 most common types of treatment are surgery, radiation therapy, and chemotherapy. The most appropriate treatment for a cancer that has not spread is surgery. Sometimes it's followed with radiation therapy. If the disease has spread, chemotherapy drugs are used. These travel through the blood vessels and destroy the cancer cells. Frequently, all 3 types of treatment will be given. This holistic or combined approach has led to better results and improved quality of life.
When is surgery used?
Surgery is the most common and oldest form of cancer treatment. It's used to remove the entire tumor if it's in its early stages and easy to reach. It can cure a patient if there's no spread of the disease into other organs and the whole tumor can be removed. Often radiation or chemotherapy will be used after surgery to try and ensure that all the cancer cells are destroyed. Surgery will also be used to relieve pain, where the tumor is pressing on or causing a blockage to other organs. It's also used to reconstruct the affected part of the body, to make it as normal as possible after treatment. This is often done after a breast mastectomy, or for patients who have cancer of the head, neck or face.
When is radiation therapy used?
Radiation is another method of treatment. It consists of the beaming of high-energy X-rays into the cancer cells, killing them. It's a local treatment and acts only in the area where it's given. Unfortunately, nearby normal cells are also killed by the radiation. This can cause some side effects. For this reason, the treatment is carefully planned. The patient is precisely marked on the area where the tumor is situated before radiation is started. Radiation is usually given once a day over a period of time. Each treatment takes 5 to 10 minutes and is painless, with the same feeling as having an X-ray. The treatment takes from 1 to 8 weeks to complete. This depends on the type of cancer and its site.
Does radiation have side effects?
The side effects of radiation are minor for most people and depend on the area X-rayed, the amount of radiation given, and the period of time. Nausea, vomiting, diarrhea, and difficulty in urinating can occur if the stomach or pelvis is being targeted. Pubic hair may fall out if this area is radiated. Radiation of the chest may cause a shortness of breath and a sore and dry throat that makes swallowing painful. Treatment of the head and neck can cause hair loss, which is temporary unless high doses of radiation are given. Sores in the mouth, headaches, loss of appetite, and change in taste could also occur. Generally, most patients complain of a feeling of tiredness and a dry or tender skin during radiation. It's important to talk to your doctor about any problems that may occur with your type of treatment.
Does everyone have side effects?
Not everyone will experience side effects from radiation. This does not mean that the treatment isn't working. The majority of side effects are harmless, though some might be unpleasant. Treatments to control the side effects are available. Your doctor can prescribe them to improve your quality of life.
Is there anything I can do to help the radiation treatment succeed?
We recommend the following 5 things. 1. Get enough rest and sleep. 2. Eat a balanced diet where possible. 3. Do not wear tight-fitting clothes. This may irritate the skin where treatment is being given. 4. Do not use any beauty products, such as deodorants or soaps, on treated areas, without speaking to your doctor first. And 5. Always protect your skin from the sun.
Tell me about chemotherapy.
This is often used if the disease has spread into other areas of the body. It's also used following surgery of certain affected organs, such as the colon. It acts as a preventative therapy in those patients that are at a high risk of developing metastatic spread. It uses a group of drugs that travel in the bloodstream, destroying cancer cells.
How is chemotherapy administered?
It's administered in different ways. 1. Tablets that are swallowed. 2. Intramuscular, which is an injection into the buttocks or upper arm. 3. By injection into a body cavity, for example the bladder. 4. Intravenous or IV drip into a vein over a period of time, ranging from a few minutes to a few hours. 5. It can also be administered through what is called a port. If chemotherapy treatment is required on a regular basis, a thin plastic tube can be inserted into the vein and taped in place. This saves the patient from the trauma of repeated injections. 6. By lumbar puncture, where chemotherapy is injected into the fluid of the spine.
How will my chemotherapy be administered?
The way you are given your chemotherapy will depend on the type of cancer and drugs that are used. More than one type of drug can be used at the same time, and your doctor will prescribe the correct combination.
How often is chemotherapy given?
Most are given once or twice a month. This can vary depending on the type of cancer, the drugs being used, and the patient's response.
Is chemotherapy painful?
Chemotherapy is not usually painful while being given. Some drugs can cause a burning or itchy feeling at the injection site. If you're experiencing any pain during the treatment, this must be mentioned to the medical staff immediately.
Does chemotherapy have side effects?
Yes, it attacks not only fast-growing cancer cells, but also normal cells that grow at a similar rate. As some of the healthy cells are destroyed, the body can respond in a negative way with side effects. Not everybody has the same degree or type of side effect. They vary with the type and strength of the drug used and the person's reaction to it.